The information provided on Terminal Addiction Podcast is for educational and informational purposes only. It is not intended as a substitute for professional medical or mental health advice, diagnosis, or treatment. Always seek the advice of your physician, licensed therapist, or other qualified provider with any questions you might have regarding medical or mental health condition. Never disregard professional advice or delay seeking it because of something you heard on this podcast. The views and opinions expressed by the guests, the hosts, are their own, and they do not necessarily reflect those of any affiliated organization or institutions. While we strive to provide accurate and up-to-date information, we make no guarantee regarding the completeness, reliability, or applicability of the content discussed. Listening to this podcast does not establish provider-patient relationship. If you're experiencing a medical emergency or mental health crisis, please contact emergency services or crisis line immediately.
All right, welcome back to another episode of Terminal Addiction. My name is Doug H.
And I'm Paul B.
Hey, Paul, how you been?
Well, you know what? Since about 10 seconds ago, I'm still doing okay.
Yeah, we split this one into two-parters. So we're still sitting here, Paul and I. We still have our wonderful guest, Kayleigh, with us. How you doing, Kayleigh?
Great. How you doing?
Good. So last episode, we were talking about, the family dynamics, and we want to keep going with that because the longer I'm around, and I see this from a treatment perspective as a counselor, I think the family stuff is really important. I look at, some of the recovery resources that people have, and the people that come in and their parents, their kids, their loved ones, their friends are supportive, they tend to do a little bit better. And the ones that are just kind of out there on an island, or, their disease has progressed to a place where people, don't want to or can't be around them anymore, they tend to struggle a lot more. And I know that, reaching out and building that sober support network is hard for a lot of people, especially if they've been isolated or keeping to themselves for a while. So I think with this episode, I think we'd like to dive into, some more of the family support, the dynamics, and just hear what you guys have going on.
Yeah, certainly. And we have a couple other topics that we'll probably bring up later on in the episode if we've got time. But dealing with a family member that is going into recovery, especially as a recovering addict myself, my wife asked me right after we got this person admitted how I was doing. And that was a really important question for me. It was uncomfortable being around somebody who had alcohol in their breath. Okay, got it. But it was also uncomfortable seeing myself in that situation that I was in, just 6 years ago. I could have easily been on the other side where somebody was driving 30 miles to come pick me up and take me to the nearest hospital, nearest ER, in order to get admitted for treatment. So it was tough. It was mentally tough doing that 12-step call last night. But in other ways, it was very fulfilling in that I was able to help another addict. It doesn't make it easier. I've lost several friends over the last couple of years, including a secretary of a meeting that I was running that ended up dying of this disease. It doesn't get easier when it comes to that kind of stuff.
Yeah, I know. I know who you're talking about there, Paul. And watching people come in and out is hard. But everybody's on their own journey, and we're here. We don't really turn people away. We like to give people second, third, fifth, 10th, 100th chances because I don't know when somebody's going to get it, and I don't want to not be there, for them when they're ready to do this. I think there's a level of commitment that we can see as counselors, but I never know who walks in those doors, who's going to get it and who's not. And I know Kayleigh and I have been doing this for a few years now. And we've seen, a couple people come in and leave, and we never hear from them again. I know we've had a couple people die. And unfortunately we're waiting on another one to die right now, it feels like. So, I now understand the severity of it. I think I had such a distorted perception of what was going on and what I was doing. And my thinking was just, god awful, impaired. And I didn't see what was really going on. And, now, a few years into this thing, I can understand why people were worried. I understand why people pulled away. I understand why people had to, set boundaries with me, because, they love me, but they can't be around me. So, I'd like to hear some of your guys' input on this as well, and what you guys had to go through and what you've seen, in recovery, because not everybody that comes in is ready, and not everybody that comes in gets it. So I'd like to hear from you guys, your perspective.
Yeah, it can be heartbreaking sometimes, because you see these wonderful, people in front of you that have families that love them, and then you're just watching them turn into somebody that's just unrecognizable. And it is different being on the other side, because I didn't really see what I looked like. And even if I did, I thought I was doing good and looked great, and I just looked like I had half an eyebrow when I came into treatment.
I was going to say, you were missing an eyebrow when
and a pocket full of mustard.
Yeah, everybody thought I was homeless, eating mustard packets. I was just so crazy, but in my mind, I was, not that bad. And I think that sometimes that's why I can get maybe a little more direct and harsher approach, because that's what worked with me. So when I work with it, I really needed to hear the truth, because in my mind, if I got away with something, it could have been like, oh, I spent all my money on drugs, now I can't pay my bills. Well, I can reach out and maybe I'll have somebody else pay it for me. And then people got smart and they're like, oh, you need gas in your car? I'll meet you at the gas station. Oh, son of a bitch, and I don't need it now. People started catching on. And when they did that, things started to crumble when they left it up to me. And when I came into treatment the last time, all these defenses that I told myself to allow my disease to progress, I'm not that bad of a mom. I still have custody of my kids, and I have a great job. And people, when I first started going to treatment, they'd be like, "Oh, you don't look like an addict." So that just fed into it. I thought I was unique and different, and so I came in here, and now I got this, I'm losing a kid. I lost my job. I got evicted because they don't appreciate it when you wake up in the wrong apartment. Don't do that. They don't like that. So everything was just stripped away, and then there's no more excuses left for why I should continue, doing what I was doing. So I try to, bring that to my brother, like, look at your life. Look what happened. And he goes, here's his defenses. Well, Kayleigh, I've been like this my whole life. And I'm like, that's the fucking problem, man. we gotta change our behavior. So if you're not willing to come in and change your behaviors and let go of control, and listen to this, because our brains are crazy. My best thinking thought, hey, I'm tired of alcohol withdrawal. We should do meth. That was the thinking I had when I came in here. So I had to listen to somebody else. So until they're really ready to give up that control and surrender, I just don't know if the outlook would be too good. So.
And I think that kind of brings us to, life on life's terms. We were talking before we started recording. You went to a concert last night, and there was a way more many people there than you thought were going to be there, and so you had to figure out a way to deal with that. And in recovery, I've had to learn how to deal with a lot of different things that. Back when I was drinking, it was simple. I'd go to the trunk of my car, get that bottle of vodka out, and wow, now it's fixed.
I know. Until the next day. Yeah. For me, setting boundaries with myself has been really important. I like to go to, sporting events, concerts, and all that kind of stuff. But, and I have a really good friend who used to go to a lot of shows with me, but due to, his family getting bigger, he hasn't been able to go to as many shows with me. And, I'm still have that distorted thinking. It's like, oh, I'll be fine. And anytime I hear myself saying something like, oh, I'll be fine, I need to catch that. It would have been probably smarter for me to invite somebody else to go to that show with me. But alas, I went, and there was a whole bunch of drunk people, and they oversold the concert. And I found myself having like a mini panic attack. And so, my options were stick it out and be uncomfortable, leave, which I really didn't want to do because I paid $100 for the ticket, or find a different place to try to observe the show. So, I got away from the bar. I got away from all the people that were, drinking. And I stood over by the merch table, which was real far away from the stage, but I could see outside. And I got to enjoy the show. I go to a lot of shows, but there's so many shows that I don't go to, either because, travel, hotels. I know Paul and I have talked about, staying in hotels and traveling on this podcast a couple times. But if I don't feel like I'm ready to go to a show, or if I don't feel, spiritually fit, I don't go. And last night was a prime example of sometimes why I don't go. So I made sure and got up this morning and went to a meeting and talked to a couple people, Paul and Kayleigh, and a couple people at the meeting about what I experienced. And I felt better, hearing other people's, experiences doing that kind of stuff. But I gotta set boundaries with myself, with other people, and with the disease. So like I don't have a whole lot of people over to my place. I'm real protective of my serenity and my peace of mind, and I like my boring little calm life. So I don't invite people in that could possibly disturb that. I will go out, and I have friends that still will have a drink, but I don't like to be around people that are getting drunk. And I think there's a distinction there. So, I've had to learn to set boundaries with myself the same way that other people had to set boundaries with me at one time. Because, I was not healthy for them. I was not good for them to be around. And the more they had to see me, the more they were worrying about me, and the more destruction and havoc I was causing. So I learned how to be, set boundaries with myself. So, it's been really smart, and it's been really good for me.
How about you, Kayleigh?
Yeah, absolutely. I think, and this kind of ties back into the family stuff too, because I had to kind of set boundaries in early recovery with my family, because now, okay, here was crazy mom who was always passed out on the couch, where she was missing for 4 days. Who knew what we were doing? And now I'm present, and I want to know what's going on, and I'm going to a meeting, and I'm helping out around the house. Well, that was the thing, is that, I had kids and a job now, but I have to make my recovery my priority at all times. Anything I put in front of my recovery would be the first thing that I lose. So, if I'm not sober, I don't have my kids. If I'm not sober, I don't have this job, and, all that stuff. So it was a learning experience with my family, because now it's just like, okay, I got to go to a meeting tonight, and first was they didn't trust me still, she just got out of rehab and you're going to a quote unquote meeting.
Right.
And funny story about that real quick is that I did actually go to a meeting one evening, and one of the other members, they had somebody donate a lot of farmer market, like watermelon, corn, stuff like that to their sober living house. They said, we have all this food, and here, take some of this home. So I, went to a meeting and come back like I had just left a farmer's market. So that was a whole, like, you were not at a meeting. What'd you get? You coming back with bushels of corn from the meeting? That doesn't make any sense. But I knew I was doing the right thing, and I had to, I earned that distrust, right? Sure. All those years of drinking and not doing what I was going to say. And, I had to, kind of, respect that for a while and listen to what they had to say. But that was no excuse to, oh, you think I'm using, I might as well go and use. Well, that doesn't make any sense, right? You hurt me, I hurt me. Okay, that makes no sense. So I had to really make sure that my family understood that meetings were important to me, and I had to go. And when they would get, maybe upset, and usually it wasn't I was going to a meeting, is because they had a bad day, and, it wasn't really about the meeting. But I'd be like, hey, do you want me to be gone for 2 hours or 4 days? And they're like, okay, go to the meeting. That's fine. And also learning to let them, be responsible for their own feelings, sure. And those kind of things. So I knew, okay, I'm doing the right thing. I'm not doing anything bad. I'm not buying drugs, none of that other stuff. I'm going to my meeting, treating my disease that day. And then what happened is that became the new norm for my family, right? Mm-hmm. So Cash ended up loving the meetings. So I'd come home from work, he's outside on his bike. Mom, you going to a meeting tonight? Can I go? And I swear this kid had more tenacity than most people in AA I know, because one day I was taking him to the doctor, and he was so sick. He had fever, he looked terrible, And on the way up to the doctor, he's all flushed, and he's in his car seat, and he lifts his head up, and he goes, Mom, after the doctor, can we go to a meeting? And it just cracked me up. So He ended up loving them and likes going to them and stuff like that. And then, hey, what time should we have dinner? What time's your meeting tonight? So we know when to cook dinner. So they grow with you. And then it's just got to stick with it and give it time.
Yeah. And, I've talked a lot of times about traveling because I love to travel. And my family knows that during the times that they have AA meetings on the ships, I'm going to be indisposed of. We've talked about going to sporting events and, how do you deal with all the people that get drunk at sporting events? Well, you learn to do that. I have a friend who likes to go, but she likes to drink heavily when she's at a meeting, or at a game. So I've made that boundary. Okay, we're not going. We're not going with them, or if we do, after she has a second drink, we're out of there. So we have to make our own, not only setting boundaries, but make our own way of staying sober ourselves.
Yeah, and I think kind of what you guys were talking about. Learning or relearning how to communicate in a healthy way. I think it was a lot of fear from my parents that was coming out as anger. And I didn't understand that. And so I would throw more anger back, and then that would just ignite the situation. And there were times where I remember not talking to my parents for weeks or months at a time. Or I might talk to my mom, but I couldn't talk to my dad because we would just, pick up where we left off and just start fighting again. So, just some tips, because I know we've got, a lot of people in recovery that listen to this podcast, but I know we've had some people that have tuned in who are not in recovery. So just some ideas, don't engage with a person when they're, under the influence. I don't think you can talk with a person who's drunk or high or in a hurry. I think paying attention to your tone and your volume. I've gotten very conscious about the volume and the tone of my voice when I'm speaking at meetings or when I'm speaking with patients. A lot of times using I statements. Talking about how I feel, talking about my experiences. I think that has a lot more substance than talking to people about what they should do or what they need to do or what they got to do. Being able to listen. I think for a long time in my life, I would listen, waiting for my turn to talk. But the older I get and the soberer I get, I actually like to listen to understand. So learning how to communicate, I think is a big piece of this. And I heard somebody say at a meeting one time, they said, you never know when you're the only example of a big book that somebody's ever going to see. And so I want to try to be as good of a role model as I can. I'm not perfect, but I try to come out with, good behaviors and good communications and watching, my language and my tone, because I can cuss with the best of them, but I don't know that that's always the most effective way to communicate with people. So communication has been something that I have had to relearn. I knew how to do it one way, and I've had to learn how to redo it another way. So
sure.
Absolutely. And I think, too, what would be helpful for some families is to kind of separate the disease from the person. When we're sick and we're drinking and using, we got all this stuff in our body. We're not thinking straight. And this isn't to make excuses, but because I heard somebody say, "Oh, well, when you're drunk, you're doing what you really want to do. That's the true you." And I'm like, I don't know if being naked, passed out in my front yard is what I really wanted to do, guys. We're out of our minds and we're not making good decisions. So I think that's kind of important for families to remember that there,
And
sure.
Yeah. And I know that, places like Al-Anon, or Nar-Anon for Narcotics Anonymous, are great places for family members to go. I know Paul's had some experience in like Adult Children of Alcoholics, ACOA. These are places where people who are affected by the addict or alcoholic can go for some support, some education, somebody to explain some things to them. I know, at the treatment center that Kayleigh and I work at, we used to do a group called Ask the Doc. And one of our medical professionals would come in and talk to the family members and answer questions. Because I think a big chunk of this is just a lack of understanding and a lack of communication and a lack of available resources. So being able to, find people to talk to or to listen to, is really important. And I'm glad that some people who are not in recovery have tuned into this, and I hope that we're able to help some people.
So one of the other topics that I kind of looked at for today was talking. I'm getting ready to have surgery on Monday. I know you've had a few surgeries.
Yes, sure did.
Since you've gotten into recovery. I had one actually right after I got out of treatment. So I'm not new to the subject either. I've had several surgeries total, but one right after I got out of treatment. So just kind of looking at, since they do use a lot of drugs that can trigger people, they use benzodiazepines in about every procedure. Those depressant drugs can have an effect on us as recovering addicts. And that was actually one of the drugs that I used when early in my alcohol addiction was benzodiazepines. I was using Valium. So kind of get your thought on that, Kayleigh.
Yeah, so I had, year and a half sober, and I was like, what am I going to do with life now? And I decided we're going to join the Army. So I got hurt when I was out there and blew out my leg and had to get 2 knee surgeries. The second one was a complete ACL reconstruction. And what I have kind of, just because we're addicts and alcoholics doesn't mean that our pain should not be treated, right? Absolutely. Because pain's a major trigger, so if I'm in a lot of pain, even emotional pain, a lot of pain, and we're not treating that some way, you're going to go use to cope. So sometimes it's necessary to take, I think what I've found though, because I had to get a lot of dental work done too, was Tylenol and ibuprofen does just fine. I think in my head, I get so worked up about pain because I had numbed myself for so long. And then I realized I was making it a bigger deal than what it really was. And just some ice or ibuprofen, Tylenol, that goes a long way. And to realize it's okay to feel pain. And then in other situations, like you said, surgery, pain medicine is going to be necessary. But I always have safeguards in place because I know my history and I don't trust myself, so sure. My sponsor knows about it. I'm not the one that is in charge of my medication, and I don't want to tempt myself like that. So if somebody else is going to have the meds, my sponsors are going to, all of you guys are going to know about it. So I got a lot of accountability, know?
Yeah, absolutely.
Yeah, I had to, I was still drinking at the time, but I was, somewhat, lucid, and I had to have some pretty major dental surgery. I had a couple of teeth get infected that got into my jaw, that got into my throat. And so I had to go see, a dentist and an oral surgeon. I had this big goiter on the side of my head. And after I got, the teeth pulled, I had my friends, Alex and Brandy, hold my pain meds. Again, I was still drinking, but I didn't want to become a drug addict again because, heaven forbid. And so I remember she would come over every morning and give me 1 pill, and then come over in the evenings and give me 1 pill. And so I remember doing that and having a little less anxiety and stress about the whole thing. But, Paul and I, he's got to have this surgery coming up. And so we're going to sort of document Paul's recovery through it. But I want to hear kind of, some of the things that Kayleigh did going into her surgery and post-surgery, and some of the things that you're going to do, Paul, to put safeguards against yourself.
Sure. Right.
Yeah, absolutely. Kind of like what I mentioned before was, my sponsor knew about this is what they're told my sponsor. This is what the doctor plans on doing. The addiction doctors that I still work with, they know about it. I also get releases I have an addiction doctor here. So my dentist, my primary care physician, surgeon, everybody has a release for my addiction doctor. So if they need to, work together on that, they can. And again, I did not I had no control of the script. Somebody else had it. They gave it to me when it was due. It also takes a lot of stress off me because 1, I'm not tempted, and 2, they can't accuse me of doing something like, you got the pills, not me, so, I didn't do anything. Right. But staying connected with the program, I had to, talk with everybody every day, make sure that I was going to a lot of meetings, because, even though I was hurt, but taking, Percocet after a surgery or something, you're still activating the craving center in your brain. So I'm good today, it's fine. But the next week it hits me like, oh man, I really want to use. So around that time, before and after, I had to make sure I was working a strong recovery program, just to make sure, I got through okay.
Sure. And I had a conversation not only with the surgeon, but I had a conversation with the anesthesia team last week, and gave them a heads up. There are certain drugs that I absolutely don't want to get during anesthesia, and make sure that they all understand that. But the other thing is, and Kayleigh kind of alluded to it, Tylenol and Motrin, being the nurse on this board here. There was a study done a few years back, and they found that after 7 days, most people can't tell the difference between a narcotic and Tylenol or Motrin. It just takes 7 days for the pain relief to be exactly the same. And so really, for years we overdid giving narcotics to people. I knew somebody who had just minor dental work done, and he got a 30-day script of Percocets and ended up on heroin because of it. We're starting to have a better understanding of how pain works. The textbook for a pain nurse is about 700 pages long. We've learned a lot about pain. We used to think it was an on-off switch, and it's a lot more complex than that.
Yeah, I remember talking with Paul, when he found out he was going to have surgery on his elbow, I think. Mm-hmm. And there were some things that he was, pretty adamant about not getting. And I think that's great to at least have that self-awareness and to bring in, your surgeon, your team, your anesthesiologist, and just go, hey, this is, what I'm comfortable with. This is what I'm not comfortable with. And like you guys have said, I found that, Tylenol and Advil work a lot better when I'm not drinking and doing other drugs. And when I took pain medication for pain, I didn't enjoy, the experience. But when I was taking it recreationally or, addictly, it was a whole different experience. And I've talked to a number of people who've had, hips done and knees done and back surgery. And, maybe for those first few days, they needed some higher test pain medication. But after, a couple of days or a week, they were feeling better, and they understood, continuing to take something just for the sake of taking it puts us in a more, dangerous area than just switching over to something like Tylenol or Advil or Motrin. So I remember when Kayleigh was down, recovering, in the barracks, they were nice enough to let her have her phone. And I remember she and I stayed in contact. I don't know if it was every day, but it was at least a couple times a week. And, she would express, concerns and worries. And, we talk about, the pain levels and everything. And I think more than anything, she was just getting bored out of her mind down there because they just sort of stuck her in a corner and threw an ice pack at her. But, I that's why I really want to do this, tracing, through Paul's recovery, because I think it'll be important, for him to get some of this stuff out, for us to talk about it, and hopefully that, somebody will listen and it'll make sense, and maybe it'll help somebody go through a difficult time, surgically, who listens to the show.
Yeah, I was listening to a podcast, that was done by a recovering heroin addict who's now a counselor. And he made a really important point. He said, just because it's prescribed by a doctor doesn't mean it's safe. Mm-hmm. Prince was very religious. Prince never drank, never used recreational drugs, but he died of a drug overdose because doctors, prescribed it for him. And same way with Michael Jackson. He was very religious, never drank, never used recreational drugs, but ended up dying from a prescription that was handed to him. So, we have to be careful. Even if, it's something the doctor says, well, it's okay. There are times that it's appropriate, times it's not. I'm not going to be the one who's going to be in control of my pain meds, knowing that I have a history of addiction. So, we just have to look at it differently.
Yeah, you talk about that. And I think Tom Petty had an accidental overdose. I think he got a pain pill from a roadie or from a crew member, and it ended up being something that it wasn't supposed to be.
Matter of fact, I saw him in concert about a month before that happened.
Good dude. And I know that working here, we occasionally see patients who will test positive and they just don't have an answer for it. But when we sit down and unpack it, I remember one lady was taking pills that she found in the couch. And I remember another guy, failed he's an alcoholic strictly. and he failed for codeine or Oxycontin or morphine or something, and he had taken a pill from a coworker, and it was like a Tylenol 3 with codeine or something. And so just being very careful about what we put in our bodies, and that goes, for prescription medications, that goes for over-the-counter medications, and I think that can go into things that we eat for sustenance, and just being careful and reading labels. And I go so far as to not have like Jack Daniel's barbecue sauce, just because I don't need that label in my head. Things that can be prepared in the kitchen with wine can usually be substituted out for something else. So just being very careful about what I put in my body, because now my recovery and my sobriety is probably the most important thing in my life. And I don't want to do anything to jeopardize it on purpose or on accident. So, I think talking about this stuff is really important, and I hope that it helps people.
Well, I think it'll be good to people to see too that you can have surgery or something happen and you can still, be okay and
Sure.
make it through. You just have to talk to your sponsor and let everybody around you know what's going on, and don't leave it up to you to control, and you can get through it just fine.
I know our medical staff here at the treatment center, they drive it home that our doctors are your doctors. And so if somebody has to go through something, because nobody deserves to be in pain. And just because we have given up our right to chemical peace of mind doesn't mean that we deserve to be in pain. And so if there's a way to go through, a surgery or a procedure, I remember, our doctors talking about the best thing to do is use the weakest medication in the lowest dose for the shortest amount of time.
Sure.
Because I do remember going to the dentist and having them throw, 30-day scripts with 3 refills on it. And it was just like candy. And I've heard so many stories about people who have flipped that switch through having a medical procedure, and they were given something that they needed, but to the quantity and the extent and the dosage was something that flipped a switch in their little alcoholic brain. So just being very careful and bringing people in, and not just thinking because we've got almost 6 years, Paul, that we got this, or that we know, or we can do this on our own. Bringing family and friends and the medical staff in to help us with this is still really important.
Well, this last hour, the last half hour that you guys have been listening, but the last hour that we've been sitting here talking has been really great. And I hope at some point you come back. And
Yeah, I'd love to. Yeah. Thanks for having me, guys. It was a lot of fun.
Absolutely.
Appreciate having you, Kayleigh. So I think that is it for us for now.
For this week?
And then Paul and I are going to record a couple of episodes as he's recovering from his surgery. And
sounds good.
We'll see how he's doing. So we'll check in with you guys later. But thanks for listening.
All right. Thanks. The views and opinions expressed in this podcast are those of the hosts and guests and do not necessarily reflect those of any affiliated organization. This content is for informational purposes only and is not intended for professional advice. Thanks for listening. If you enjoyed today's episode, be sure to subscribe, leave a review, and share it with a friend. Until next time.